Hello, I'm Christopher Springman, and this is Neph Talk, a podcast series created with nephrologists in mind from Satellite Healthcare, a not-for-profit dialysis provider and clinical researcher with a special focus on home as the industry's home dialysis leader. Our guest is Dr. Ken Southa, MD, a pediatric nephrologist at Lucile Packard Children's Hospital at Stanford. I really get the impression that you feel an obligation because so much has been given to you, not only by your father who gave you one of his kidneys, but of course a recent donor.
I've always felt it was important for me to pay it forward since I've been so fortunate in my journey. Minority communities are disproportionately affected by kidney disease. And so being able to reach out to the Hispanic community here to share my story as a minority myself, Asian American, also having increased risk of kidney disease, that was a really important thing for me to be able to do.
Dr. Southa, thank you so much for joining us today on Neph Talk.
Great. Thank you so much for having me here today.
I am looking at a picture of you on Facebook under Kidney for Ken. You appear to be in recovery after a medical procedure. Can you tell me about that picture and
That's right.
why you did a selfie of yourself in the recovery room?
Sure. That was right after I received a deceased donor kidney transplant back on July 24th of 2018.
In fact, this was your second kidney transplant.
That was my second one. I woke up from anesthesia and they brought me up from the post-anesthesia area back up to my room. And someone decided it was a good idea to let me have my phone. And so I recorded a short little message to send out to people that follow my Facebook page to let them know that my transplant was successful and to send a thank you out for my donor and for my donor's family.
You received your first kidney transplant from your father in 2006 at age 24.
That's correct.
You were fortunate to receive the kidney from a living donor. Your dad, it saved you the effort of having to start dialysis. And, as you said, thanks to this gift, you went on to accomplish more than I could have dreamed of over the next decade, completing marathons, triathlons, and graduating from medical school with an MD and a PhD. You are now a pediatric nephrologist.
That's correct.
What age range of patients do you work with?
As a pediatric nephrologist, I'm trained as a pediatrician, but I specialize in the kidneys from newborns, children, adolescents, and even some young adults. We take care of all different kinds of kidney diseases, including kidney stones, problems with abnormal things in the urine like blood or protein, patients that are born with problems with their kidneys that didn't develop correctly, and so they have decreased kidney function, patients that need dialysis, and then eventually transplant after their transplant as well.
You were diagnosed at age 10 with nephrotic syndrome after abnormal amounts of protein were found in your urine. You ultimately had a kidney biopsy that showed that was being caused by FSGS. What is that?
Yes, I was diagnosed with FSGS, which is focal segmental glomerular sclerosis. What that means is that there's scarring of the kidney, and it can be caused by a number of different things. They think that the main form is caused by a circulating factor in the blood that attacks the kidney. Either way, no matter what, the treatments are essentially the same in terms of trying to minimize the amount of protein that's being lost by the kidney, and then eventually, as the kidney disease progresses, transplant.
I would imagine there are occasions when you share your experience with kidney failure, with dialysis, with not only patients, of course, but their caregivers, their parents, their guardians, the individual who has responsibility for them. And my understanding, too, is that many people, before they have an appointment with you, will actually, of course, check you out online, which is a good thing to do, and especially your Facebook page.
Yes, I've definitely heard that from patients and their parents. Many of our patients are connected to each other through Facebook. Some of them have found my Facebook page and so know my story. I don't always share my story up front when I'm meeting the patient because the appointment is really about them and not about me. But when I see that parents are having a difficult time with a new diagnosis, I do open up and share with them that there is hope with this diagnosis of kidney disease, and their child can go on to live a normal and happy and healthy life.
How do you treat children that small with kidney disease, remembering, of course, that children, as pediatricians often say, are not just small adults?
It can be very, very difficult sometimes because newborns are, and often premature babies they're so small. For some of our babies with problems with their kidneys from developmental problems, even ones that are born without kidneys, we sometimes have to start peritoneal dialysis on them when they're only a couple of days old. And so oftentimes we have to start extremely small volumes of peritoneal dialysis and do peritoneal dialysis continuously for 24 hours with just 30 to 60-minute exchanges, which are extremely short compared to what we do in larger patients and adults.
I would imagine that the parents are in continual attendance, if that's the right term, with their child. This must be a very, very trying time, but ultimately, these children graduate from the NICU, the Neonatal Intensive Care Unit, and catch up with milestones, perhaps after having a transplant. That must be a very joyful moment.
Yes, that's definitely true. I've seen so many of our patients that were on peritoneal dialysis as infants, and they were lagging behind in their milestones in terms of their mobility and their motor skills, just because they have decreased nutrition and suboptimal growth. But after they get a new functioning kidney after a transplant, it's amazing to see that they are able to catch up with all their developmental milestones. They start walking and running and growing and all sorts of amazing things, and doing normal things that we want kids to be doing.
In fact, in your Facebook video, your selfie in the recovery room, you mentioned how nice it was to see a bag of urine on the end of your bed. It is an amazing moment for both children and adults when the kidney starts working.
When I've been in to observe transplants, the moment when they see that the kidney is producing urine is always a joyous moment. And for me, when I woke up, like the first thing I asked the PACU nurse, the post-anesthesia care nurse, was whether or not I was making urine. I was actually putting out about 1 liter an hour, I think, or something like that in that first hour after the transplant. And it was really an amazing thing after not putting out that much for several years.
Doctor, you're in a very, very unique position at Stanford's Department of Nephrology as a pediatric nephrologist in terms of engaging patients when they are young with their caregivers and advocating prevention strategies, for example.
Many of our patients have chronic kidney disease that is not quite severe enough that they're going to require dialysis or transplant in childhood, but it certainly puts them at risk for getting there as they get older, similar to the case with my disease, needing a transplant in my 20s. So for us, really trying to help to emphasize for the family preventative measures that they can do to help preserve the function of the kidney for their child and to slow down the progression of the chronic kidney disease, potentially that we could delay it further until they're later in their adulthood. Many of the things that we want to do that are important for kidney health as an adult include healthy exercise and diet. And many of those habits are established in childhood in terms of exercising regularly and eating fruits and vegetables and avoiding overly sweet foods and extra sugar. And as you mentioned, trying to get the buy-in from the family to make those lifestyle changes for the child are really important, because really it's a team effort.
Let's discuss the relationship of hypertension, diabetes, obesity, and kidney disease, and of course diet and exercise, as these relate to the new pediatric hypertension guidelines from the American Academy of Pediatrics that you were involved in that were revised in 2017.
That's correct. One of my advisors or mentors back when I was in residency at Seattle Children's was actually the lead person on that.
Let's talk about those new guidelines and why they are important, as hypertension or high blood pressure can be one of the first signs of kidney disease, and when left uncontrolled, it can damage the kidneys and itself lead to
That's right.
kidney disease. You've said that 3% of otherwise healthy children have hypertension.
From what we've seen, kids that are hypertensive grow up to be adults that are hypertensive. Hypertension is a very important cause of kidney disease, and that could be potentially preventable. So if we're able to help children to control their blood pressure when they're younger, we could set them up so that they can have healthier blood pressures in adulthood as well.
The guidelines advocate that healthy children over 3 years old can or perhaps should have their blood pressure screened at annual well-child visits, but
That's right.
it's recommended that children with known kidney disease have their blood pressure checked at all healthcare encounters.
Since chronic kidney disease itself can also lead to high blood pressure because of problems with the kidney, either from abnormal signals from the kidney or because of problems with fluid overload, because of kidney failure, kids with kidney disease are definitely at a much higher risk for developing high blood pressure.
What kind of response do you receive from parents in a case like this when you start discussing hypertension and kidney disease and the need for their participation? How do you instill in these parents or guardians a very special sense of responsibility?
It can be very difficult sometimes because oftentimes patients that come in with these problems with obesity and high blood pressure, it's something that runs in the family. Really trying to emphasize to the family that taking the team approach is vital. Oftentimes parents won't want to make the interventions for themselves though, but seeing that their choices about food and exercise are impacting their children, they always want what's best for their children.
I'm reminded of another picture on Facebook several months ago of a visitor to Disney World in Florida who was walking around wearing a t-shirt asking, well, it said, "I need a kidney." Have you ever worn a t-shirt when you were seeking a kidney?
Yes, actually, I did. So I was on the waiting list for about 2.5 years, and then I saw that picture and heard the stories about that gentleman who had that shirt, and I thought that was a great idea. And I was actually going to Disney not too long afterwards, so I had a shirt made up myself that had my Facebook page on it and my blood type and phone number of my transplant center for people to call.
And what happened? What was the result?
I definitely had people coming up and telling me that, they had loved ones that were waiting for a kidney as well and wishing me good luck. I'm not entirely sure if I got any people contacting my center directly from my shirt or not. I'd like to think that at least I was raising awareness for people to have it as something in their mind about something that other people are going through.
Prior to his second transplant, Dr. Southa was a patient at Satellite Wellbound San Mateo, a home dialysis center where patients' treatment options include peritoneal dialysis or home hemodialysis. You experienced peritoneal dialysis for 2 years in between the failure of your father's kidney and when you received a new kidney from a deceased donor.
That's correct, peritoneal dialysis.
I should think that as a pediatric nephrologist, that peritoneal dialysis administered by parents would be far more convenient and expedient.
For children, we often recommend peritoneal dialysis. It's a gentler process on the body. We're not trying to cram all of the dialysis into just a couple of short hours a few times a week. They're able to do it every day at home over a longer period of time. So that leads to a lot more stability and ability to have more liberty with the amount of their nutrition that they're getting. And as you mentioned, it's a lot easier on the family because they don't keep coming to the dialysis unit multiple times a week. The child is still able to go to school for the full school day.
Do children do nocturnal dialysis when they're sleeping?
Basically, the parents will hook up the dialysis before the child goes to bed, and they'll be on dialysis somewhere between like 9 and 12 hours or something like that, depending on if they have residual kidney function or how efficient their dialysis is.
There must be something that amazes you on a daily basis about your work at Stanford as a pediatric nephrologist in terms of watching children grow up, recover, and essentially get on with their lives.
One of the reasons I chose pediatrics and pediatric nephrology is because we have such continuity with our patients. Because we have a smaller patient population than the adults, we essentially do everything in the full spectrum of nephrology. We take care of patients with chronic kidney disease. We're the ones who manage their dialysis when they start. And then we also manage their transplants after they get a transplant too. It's really amazing to see that progression and to be able to follow them long term over the course of several years.
What's the best part of your job?
The best part of my job is definitely working with the patients and seeing them happy and healthy, and being able to help parents work through this process of dealing with their child with chronic kidney disease.
A colleague of mine at Satellite Healthcare found you at a flea market. Now, let me qualify that. It was Kidney Action Day. Tell me about that and the demographic you found at the flea market and what the response was.
I was at the flea market as part of Kidney Action Day, an event organized through the American Kidney Fund. It was an opportunity to do health screenings for people at the flea market to look for early signs of kidney disease and other conditions that can lead to worsening of kidney function, including diabetes and hypertension. Oftentimes, kidney disease is thought of as a silent disease because people don't really have symptoms that they can appreciate until their kidney function is very low and they're closely approaching dialysis.
You are certainly committed to the larger population out there, getting together with people at the local flea market, finding people where they live and play is very, very helpful. I really get the impression that you feel an obligation because so much has been given to you, not only by your father who gave you one of his kidneys, but of course, a recent donor.
I've always felt it was important for me to pay it forward since I've been so fortunate in my journey, particularly with a heavily Hispanic population that was at the flea market. Minority communities are disproportionately affected by kidney disease. And so being able to reach out to the Hispanic community here to share my story as a minority myself, Asian American, also having increased risk of kidney disease, that was a really important thing for me to be able to do. In Santa Clara County, for example, where Stanford is, 2/3 of the waiting list is minority, 1/3 Hispanic and 1/3 of Asian descent. And yet this county also has some of the lowest rates of organ donation and the longest waiting list in the state. Really being able to get out to the communities so that people are aware about their kidney disease and are talking about organ donation is important to me.
Dr. Souza, thank you so much for joining us today on Neph Talk.
Great. Thank you again for having me.